article was written to obtain the DO diploma at the International Academy of Osteopathy. The authors of this study are Morgan Dierendonck, Rani Buyssens and Delphine Verburg. The promoter is Marco Gerritse. This study was an attempt to examine the impact of an osteopathic treatment on the thoracolumbar region, on the oxygen content in the lower extremities and the posture. First of all, we will give a little background about this research. Then we will explain the materials and techniques that are used in this research and the procedure. Further, we explain the results and the discussion. And finally, we give a summary of this study. First, the introduction. The rule of the artery is absolute. This is one of the original osteopathic principles proposed by Andrew Taylor Still. Vascularization is a very important aspect in our body. Our blood circulates through our body and makes it possible to bring oxygen to our organs, muscles, brains, and so on. Oxygen is one of the most important elements of the human body. Without oxygen, our health begins to suffer. Unhealthy or fragile cells, due to wrong metabolism, lose their natural immunity. At the moment, they lead to all kinds of serious health problems. According to Courtney, oxygen gives us life but also destroys the damaging bacteria in our bodies. Vascularization is very important in osteopathy. The orthosympathetic arrangement has an effect on the vascularization. According to the research of Martini, an increased orthosympathetic activity of the primary level accelerates the heart rate and the heart muscle will contract more powerful. According to Singh, the segments T10 to L2 are important for the orthosympathetic arrangement of the lower extremities. A somatic dysfunction of the thoracolumbar region could disrupt the vascularization of the lower extremities. It has already been proven that a spinal manipulation affects the vascularization in the lower extremities. Another principle proposed by Andrew Taylor Still is that function and structure are related. According to the evolution theory of Charles Darwin, the function creates the organ. In our body, the same rule applies. The structure determines the function and the function determines the structure. These two factors are inextricably related, and because of this, our posture is very important. Until now, it is still not proven that osteopathy has an effect on the posture and the height of the thoracolumbar region. In this study, there were 4 different osteopathic treatments used: a Nelson manipulation, a mobilization, a muscle energy technique, and the sham technique. First, we investigated the effects of osteopathic treatment of the thoracolumbar region on the oxygen content in the lower extremities. We examined the effects of 4 different treatments of the thoracolumbar region and also measured how long the treatment has an effect on the oxygen content. Secondly, we investigated the change in posture at the level of the thoracolumbar region after the same treatment and determined which of the 4 treatments has the most effect. Material and methods, the study design and the setting of the research. The investigations took place in the skills lab of the International Academy of Osteopathy in Ghent. DierendonckM 3-5. This study was randomized and single-blinded. Subjects. The study population. The study population included 64 healthy participants, 22 men and 42 women, between 18 and 65 years. Participants were approached in the immediate environment of the researchers. All participants were initially screened based on the inclusion and exclusion criteria. The inclusion and exclusion criteria. The inclusion criteria were men and women between 18 and 65 years and participants who didn't present with the orange or red flags. The exclusion criteria were participants under the 18 years, over 65 years, participants with tattoos on back or flank, and participants who presented with orange or red flags. These were excluded because they had a contraindication for manipulation. The researchers. The study was conducted by 3 final year students of the International Academy of Osteopathy. The tasks were divided as follows. Researcher 1 took a scan with the Diers-Formatic 4D analysis system. Researcher 2 measured the oxygen content in the lower extremities with the OxyTrue, a pulse oximeter. Researcher 3 performed the treatment. The procedure in 6 steps. Step 1. First, the participant was weighed and measured, and also asked to fill in a questionnaire. Step 2. A scan was taken with the Diers-Formatic 4D analysis system. There were 3 scans taken. Step 3. The participant took place on a treatment table and the oxygen in the lower extremities was measured by the OxyTrue, a pulse oximeter. Step 4. The participant underwent an osteopathic treatment in the thoracolumbar region. Step 5. The oxygen content in the lower extremities was measured again with the oximeter directly after 1 minute after the treatment. Step 6. The participant underwent for the second time a scan with the Diers-Formatic 4D analysis system, and 3 scans were taken once again. Intervention or treatment. There were 4 different treatments used in this study. Group 1 received a Nelson manipulation. This happened once in standing position and the second time in a sitting position. A manipulation consists of a high-velocity, low-amplitude thrust. Group 2 received a mobilization. This during 1 minute and on both sides of the thoracolumbar region. According to Jardine and others, mobilization is a passive, rhythmic movement that is repeated by the therapist for several minutes and performed at the end of the joint range of motion. Group 3 received a muscle energy technique. The participant was sitting on the table. Then the researcher performed an isometric contraction. This takes 3 seconds. Then 3 seconds rest, and then the researcher searches a new limit. We carried this out on both sides. Group 4 received a sham technique. We used this technique as a control group. In this way, we evaluate the difference between a participant who had received a treatment and one who did not receive a treatment. The material. Diers-Formatic 4D analysis system. We used the Diers-Formatic 4D analysis system to assess the posture before and after the treatment of the thoracolumbar region. We took 3 images with the Diers-Formatic 4D analysis system before and 3 images after the treatment in order to compare the effect from the 4 different treatments to the posture. Sometimes we had to indicate the anatomic landmarks at the height of the vertebra prominence and the 2 iliacal posterior superiors. because sometimes the analysis system didn't give a clear image. According to Knott and others, it has been proven that it is not necessary to make adjustments to the landmarks because the results are not changed by these indications. When using the Diers-Formatic 4D analysis system, it is very important that the patient is correctly positioned. The Diers-Formatic 4D analysis system makes a static and dynamic measurement of the spine. It is a non-invasive and radiation-free method. The analysis system uses the Moiré principle to access the spine configuration of the body statics, surfaces, torsion and balance, scoliosis, and all forms of spinal deformities. Oxy through a pulse oximeter. In order to measure the oxygen content in the lower extremities, we made use of the oxy through a pulse oximeter. The researcher placed the oximeter on the big toe of the right foot. The measurement of the oxygen content took place before, directly after, and 1 minute after the treatment. In this way, we could compare the effects of the 4 different treatments on the oxygenation in the lower extremities and see which treatment has the most effect on the oxygenation. Data analysis. Data were entered using the Excel spreadsheet software. The statistical analysis has been performed with the statistical software. Statistical Package for the Social Science, SPSS. Results. Distribution of groups. Remark. In the results, some outliers could be seen. These are due to the unpronounced results of the oximeter and the Diers-Formatic 4D analysis system. Therefore, we cannot speak of an equal distribution among the groups. Oxygen. The results of the Kruskal-Wallis test showed that there is no significant difference immediately after and 1 minute after the treatment. However, the paired sample t-test showed that manipulation and the sham technique have no significant difference, but mobilization and muscle energy technique have a significant difference before and after the treatment. ANOVA was used and showed that there is a significant difference for variable lordotic angle TLILS max underscore DAG. The p-value equals 0.04. For all the other variables, there is no significant difference. For variable lordotic angle TLILS max underscore DAG, there is almost a significant difference. P-value equals 0.059. But it was determined that the number of usable samples for group is still slightly lower than the number of participants. The paired sample t-test showed that there is no significant difference for Nelson manipulation, mobilization, and the sham technique. But there is a significant difference for the 2 variables of the muscle energy group. Discussion. Distribution groups. There is no matching of the control and treatment groups. In the variable age, BMI, and gender, there is no match between the 4 groups. The distribution of men and women in this study is unbalanced. We also notice that the average age of group 1 is lower than in the other groups. In the results, some outliers could be seen. These are due to unpronounced results of the oximeter and the Diers-Formatic 4D analysis system. Therefore, there are in group 1 and group 4 2 participants less than in the other groups, and because of that we can't speak of an equal distribution among the groups. Oxygen. Our research shows that there is an increase of the oxygen content immediately after and 1 minute after the muscle energy technique. There is also a rise immediately after the mobilization. Manipulation and sham therapy have no pronounced effects. We find the oxytrue a pulse oximeter not completely reliable. The oximeter gave us sometimes results that weren't plausible because the values were too low. Normal SP oxygen values vary between 95 and 100%. Often we got a SP oxygen value below 95%. Throughout our research, the researchers experienced that the oxytrue pulse oximeter often needs more time to measure the oxygen content in the lower extremities. This gave as result that the time that the oximeter took to measure the oxygen content in the lower extremities wasn't always exactly 1 minute after the treatment. Due to this, the time was not the same for all the participants. Another reason why the oxytrue pulse oximeter values were not reliable was because the oximeter cover did not fit on every distal phalanx 1 on the foot. Consequently, the researchers had to measure the oxygen content in the lower extremities by using the distal phalanx 2 instead of the distal phalanx 1 in order to obtain a value. Because of the unreliability of the oxytrue pulse oximeter, there can be concluded that there is no significant difference on the oxygen content after the treatments. For subsequent research, it might be more interesting to measure the blood flow instead of the oxygen content. This could happen with the Doppler ultrasound. Posture. Before this research, there is no proof that an osteopathic treatment of the thoracolumbar region has an effect on the posture. This study shows that there is no significant difference between the posture before and after the treatment for the Nelson manipulation, mobilization, and sham technique. The results from the muscle energy technique showed that there is a significant difference before and after the osteopathic treatment, 2 of the 5 variables on the posture. The fact that the posture did not change after the osteopathic treatment can be linked to the short duration of the osteopathic treatment, and that the treatments were carried out by 3 different researchers. So the treatment is never quite the same. In the future, there should be more research about this topic, experimenting with a longer duration of an osteopathic technique to find out what the effect is on the posture. For the measurement of the posture, the researchers made use of the Dierindonkk 4D analysis system. This appliance is reliable. The participants had no stance in a precise position to obtain a perfect analysis of the posture. The only disadvantage of the Dierindonkk 4D analysis system is the accuracy of the position of the participants. When the participant is not in the perfect position, there are no useful measurements. In further research, there needs to be more professional and reliable material at the disposal of the researchers. It would also be more interesting to use participants that have already a decreased oxygen content in the lower extremities. With healthy participants, it is very difficult to identify an oxygen rise in the lower extremities when the oxygen value is already high. Out of this, there can be concluded that there is no significant difference on the posture before and after the treatments. Conclusion. This research shows that the oxygen content in the lower extremities increases after immobilization at the level of the thoracolumbar region. However, this increase did not last longer than 1 minute after the treatment. The muscle energy technique gives an increase of the oxygen content immediately after and 1 minute after the treatment. The other two used osteopathic treatments, Nelson manipulation and sham therapy, have no pronounced effect on the oxygen content in the lower extremities. This study shows that there is no significant difference between the posture before and after the Nelson manipulation, the mobilization and the sham technique. The muscle energy technique shows that there is a significant difference before and after the treatment for 2 or the 5 variables on the posture. Generally, there can be concluded that there was no significant change in the posture after the osteopathic treatment.